we want to support a collaborative training, and so to be able to talk about this topic. To remain abreast of the last information, you can remain on our social media and you can scan the QR code on the screen. Our next webinar will be held on April 9, use of the action data and information system, and on May 14, immediate kangaroo care, implication of the Omwana clinical trial. We invite you to introduce yourself in the chat, to list your organization and your name. And if you wish to listen to the webinar in English, please choose the channel at the bottom of your screen. Next slide, please.
And we have two exciting upcoming events. The next one is on April 9th, using data for action. And the following is on the 14th of May, immediate kangaroo mother care, implications from operationalizing kangaroo mother care before stabilization amongst low birth weight neonates in Africa. So we welcome you to introduce yourself in the chat. And if you would like to listen to the webinar in English, please select the English translation button at the bottom of the screen.
We will start by introducing our moderator, Papa Mokhtar Faye, Professor Papa Mokhtar Faye. He is a main professor of pediatrics at the University of Sheikh Anta Diop of Dakar and the neonatology service head in the National Hospital Center in Royal de Dakar and vice president of the Neonatology African Association. Thank you. Thank you so much. Thank you to Lauren for this fantastic introduction on this important webinar. To remind everybody of the importance of this topic, which is a source of documents and information. This is extremely important for everybody who works in the sector of health sector, in particular in sub-Saharan countries where the French language is the official language. So it's a great honor for me to moderate this session, during which we will have 3 presentations. One from Lauren Allison, another presentation from the African Association of Neonatology, and the third presentation, which will be online, of actually 4 presentations with a pre-recorded video from Youssef Wako, and we will close with a presentation from the foundation, which I will introduce with a short presentation. Next slide, please. Next slide, please. Next slide, please. Thank you very much. We are here to discuss the burden of the death levels or rates among newborn in sub-Saharan Africa. I'm sorry, Lauren. I would like to start by introducing you. Yes, sure. So sorry. From the previous slide, Lauren Allison is a pediatric nurse and neonatology nurse. She has a lot of knowledge on newborn care, and she manages everything as far as knowledge and for the toolkit, which is the topic of our webinar. Thank you, Lauren. Back to you. Thank you so much. Next diapo, next slide. I will start by giving you an overview of the current situation in the French-speaking countries. You have data from the UN agency for the infantile mortality on the global level in sub-Saharan country for mortality rates, national mortality rates are illustrated here as well, and the goal of the sustainable goals has put national targets for 2030, and roughly 64 country risk not to reach that goal. So uh, uh, these are the countries who are affected by national conflicts. The mortality rate in fragile or conflict countries are higher than countries which are not weak or afflicted by conflicts. The mortality rate is indicated on the left. It is over the national objective defined for the SDD. So we have those for UN IGME for 2022. Next slide, please. So we have to wait for the SDD for 2030. In spite of the a lot of uh, uh, facts, in fact, in favor of care for newborn, there is a lot of research using access for the care for newborn. This study produced 559,836 results in English and 7,274 results in French. There is a huge gap between both languages. And to guarantee the implementation of the care to newborn, small and sick newborn in French-speaking countries, it's very important to have results in French. So we have a lot of work to do on that level. Next slide, please. Uh, so this is the example of the day. The toolkit to implement care for sick and small underweight newborn. Who is responsible of the implementation? To be able to share and learn. Recently, it has been launched in French during a recent 2023 meeting, and it was organized for a health system in the UNICEF. So these are, you see on the slide, the politicians and health professionals, leadership and governance, and finance people, founders and ONGs. There is a lot of stakeholders engaged in this process. Next slide. In 2023, the toolkit for newborn has 28,000 users, unique users in 2023, and 170 in French-speaking countries. This measure gives you an idea of the original country of each users. The next slide. What does the toolkit have? We have a list of resources. We have the training tools, training material, investment cases, medical control list, the plans and lectures, and more resources listed on the screen. You have a number of resources available according to language, and there is a lot of differences according to language. And you see that English is the language where the toolkits are available most. Donc, we need to be able to provide that kind of tools in each of the language listed on the slide. Next slide. How can we do this? One of the key elements of the implementation and engagement of people in charge of the implementation are in this toolkit. Seminars are organized online on the topics which are key to newborn health. And these are available on the website. And last webinar will be organized on that type of theme and for rapidly developing countries and with national examples and data regarding newborn and to stay abreast of information and the latest news. We have information newsletter in French. Next slide. Finally, I'm going to close with the opportunities of engagement that we organized last year, the implementation leaders to talk in favor of investment for care of small and sick newborn and they obtain a prize of £500. Among the winners, you had two doulas who won that prize. Thank you very much. We hope to hold those events more in the future to speed up progress in realizing ODD national targets. Thank you so much, Lauren, for this presentation, which showed the heavy burden of mortality in in French-speaking Africa, and particularly West Africa. And we are very far from the 2027 ODD, SDD. Donc, we are 3 times more than the goal uh, for the SDD. She also showed that there's very few data which are available in French, and the toolkit, which is 10 components, which should be available in French to be able to use resources for the newborn health, because you have about 150 in French. For the latest toolkit, and it showed the mortality, and that this toolkit is important for neonatology specialists working in French-speaking countries. Thank you so much for this information. The next presentation will be in the hands of Frank Hundiayo of Neonatology African Association, who is also the secretary of the African Journal of Neonatology. He will speak about the role of the ANA, the Neonatal Association, in the training and learning and accessibility. I guess the ANA, it gives accessibility to resources regarding newborn health. As I mentioned, Dr. Frank Andiayo is a pediatrician who is currently residing in the United States, because who is very active in the African Neonatology Association, and who is also a contributor to the Journal of African Neonatology, and he's the head of the Association Research of Neonatology. He is the secretary of the committee for this journal. Okay, I will give, without further ado, the mic to our dear professor. Thank you so much, dear colleague, for this introduction. It's a great pleasure for me to be part of this group and to have the opportunity to talk about the Association of Neonatology of Africa and the role of this association, and can still play in the promotion of the toolkit, which is extremely useful and which was presented earlier. Next slide, please. We will briefly introduce this association to talk about its existence and its visibility on the African Journal, and close with the activities that the Pediatrician Association plays in favor of the toolkit. Next slide, please. The Association of African Neonatology is started in September 2021. It's an association which neonatologists and pediatricians who are active in African newborn care. This association was born in a context environment where neonatal mortality remains a great challenge in sub-Saharan Africa. A child born in sub-Saharan Africa has 11 times more risk to die during the first month of his or her life than a child born in other region. So the need to act on to reach the SDD 3.2, targeting neonatal mortality in 42 African countries. It's not an additional association, company, or organization. It wants to be part of this fight. It has currently more than 321 members in 37 African countries. The vision is to give African newborn children the best possible start in life. Next slide. The activities of the association are coordinated by the executive office and are based in the field by subcommittees of research, which led the association numerous research, and I thank all the countries engaged who engaged spontaneously in this search, and to raise visibility so there could be more African countries represented in the research for newborn care, and subcommittee for education, uh, which supports initiatives and conferences and webinars such as the one we are holding today to communicate on the situation and the activities in this realm. Finally, the subcommittee for a collaboration and advocacy to be able to push this agenda. Besides that, we have work groups uh, focusing on various themes, which are the cause of mortality among newborns. Next slide, please. For in terms of visibility, the association created a website. You see the address listed on the screen, displayed on the screen in French, English, and Portuguese. This website has useful and educational resources also for, as well as for parents and for health workers to talk about nutrition and mothers regarding newborn nutrition or premature newborn nutrition, and also for health care workers for scientific articles and recommendations and links towards sites where they can learn on this topic, and which we invite you to share with everybody. This will help you orient towards international and national organizations acting in the sub-Saharan and the countries and the African continent in general. Here, here are displayed on the screen our main collaborations and partnerships. Some of them uh, on a financial level, we have the Chiesi Foundation to develop research sites. At the top right hand corner, you have a consortium which just started on the implementation of data for intensive care. A few months ago, we inquired as to the availability, and we are partnering with universities. And these are just a few examples. Recently, there is a collaboration with a university which will develop very soon, and we are discussing and talking with them currently. Donc, this association acts on the field. Next slide, please. The journal which is linked to this association is the Neonatology African Journal. This journal is bilingual, so it's published in French as well as in English, in French. It focuses on the neonatology topic, medical as well as in surgery. So uh, we want to be have a representation in Africa in research and in neonatology. To submit articles, you can go straight to the website, or you can go talk to the secretary, and you have the email displayed on the slide. Here's a graph which is similar as far as tendencies to the data which were previously presented. You can see that the English publications are way over than French language publications. So we need to all of us work to raise communications in the French language. And it's the same idea as far as this toolkit that we need to all collaborate to put together. Uh, when you see this graph, you see a huge difference between English and French publications. On this map, you see that kind of differences in the French-speaking countries. So we have a lot of work still to do on that level. Here are all the advantages of the toolkit. The African Neonatology Association, the ANA, can have a few strategies to facilitate accessibility and dissemination of the information with the communication with webinars in French language, support the dissemination of the toolkit in the network to help us to partner between the ANA and a national pediatric association and the countries affiliated with the ANA. And scholarly publications. Donc, we need to encourage and support research that takes into account components of the toolkit by offering the possibility of publication in which will be launched in a few weeks, which will publish the results. So we will always ready to put our journal, make our journal available, including all the toolkit's components, and also advocacy with universities to include the toolkit as a crucial source of information with nurses, students, medical students, interns, and subcommittees of education such. Conclusion. African Neonatology Association is engaged to support all and any action in favor of the agenda of the African newborn so as to realize for each of its members to realize the SDD of 2030. We want to seize this opportunity to invite each and every one of you to take advantage of the toolkit and to get involved. Thank you very much. Thank you so much, Doctor, for this incredible presentation, which allowed us to to know the ANA a bit better, which is the greatest scholarly association in French-speaking Africa. And you showed us the use of this association towards the newborn health, and also you showed us the partnerships available. And this association since 2021 is really very useful. You showed us that the Neonatology African Journal, which is linked to the Scholarly Association, which was created in 2023, in which has information on neonatology, and even though, as usual, the English language is predominant. Thank you for all the information on this journal. And he talks as well on the role of the association of African neonatologists, who will continue to work on having the toolkit in French, and to be able to put it, make it available to everybody, as well as to scholarly organizations such as the ANA, to use this toolkit as a source, crucial source of information for all stakeholders. Thank you so much again, Chair, dear Dr. Frank, for your excellent presentation. Right now, next presentation, which will follow. We'll have Dr. Tomomi Kitamura, and his presentation is pre-recorded. She is a UNICEF and West and Central Africa based in Dakar, and she will talk about the role of governance agency in the fight against linguistic inequalities, among others, in Africa. Dr. Kitamura is a health specialist and head of the regional office of at the WCARO at the UNICEF. Now we will get the video on. Hello, very nice colleagues. My name is Tomomika Tamura. I work for the African Regional Office of the West and Central UNICEF, West and Central Africa at UNICEF. I am a specialist in maternal health. I am so sorry I am not here with you since my internet access is limited. I thank you to allow me to share my views regarding linguistic inequality. I want to share my personal experience. I am from Japan. English and French are not my native languages. So I understand very well uh, the issue of language access. The key documents for newborn health are available in French and English. for political documents. So, for instance, the every newborn action plan, the orientation is available in French, but other documents such as the progress report and the roadmap and other documents are just not available in French. As far as the directive, leading lines, guiding lines, the documents are not yet translated, but the guiding guidelines and other documents and the WHO recommendations are already published in French. We are in collaboration with other organizations to translate the guide and the practical guide and information packet to talk about healthcare workers' well-being. We want to share this type of documents this year. As you know, we are working hard to make these documents available, make these documents available in French. The action plan for each newborn is available. It was a special year. There were two great events for neonatal care. There was a Maternal and Neonatal Health International Conference in 2023 in South Africa. During the conference, 30 countries started to plan for acceleration plan on maternal and neonatal health. And efforts are there to end avoidable neonatal death. There is an analysis of the situation and identify priority actions and finalize a plan with a timeline and responsible countries. This means that we have a collaboration in the toolkit to facilitate this process. The other event for the newborn and child health during this forum, we shared the initiative called Action for Child Survival. It's a plan to allow initiative of action to allow child survival with similar goals to the SMN acceleration plan for children aged 1 to 59 months. In this process, Ilya, you have other initiatives in 4 countries in West Africa and Central Africa, and they are formulating an action plan or operational plan to involve maternal, neonatal, and infant health to ensure the continuation of care and synergy and to better plan activities. It's really the time to take the experience of French-speaking countries and beneficiating who are enjoying this initiative Together, we can go further to be able to have these documents available in French using the toolkit uh, to reinforce collaboration with the UN, with the foundation as well, and to explore a collaboration with the professional associations such as the ANA and the Federation of Midwives. Thank you very much. Thank you very much for this incredible presentation. Talking about inequalities as far as language for the availability of documents. And regarding general politics documents and health documents and neonatal and newborn health. All of these documents and these strategies which are available in English, even if there are promises, but there is still inequality of languages and translations. Excuse me, I think that now we will start our last presentation. Our last presentation from the Chiesi Foundation. Given by Massimo. Which would deal with the examples of the Chiesi Foundation, which is a pharmaceutical foundation. And Massimo Salvadori from the Chiesi Foundation will be making this presentation with examples of pharmaceutical foundations. Who is Italian, but leads a lot of action in the research field and helps the ANA and the toolkit to promote newborn and child health. Massimo, you have the floor. Thank you. Thank you Thank you for your introduction, and also thank you so much to invite me. Next slide, please. Thank you so much. Chiesi Foundation, we are an organization, a non-profit organization founded in 2010. Our theme focuses on scientific research and international cooperation programs in neonatal and maternal health. Our geographical focus, we work mostly in sub-Saharan African countries, specifically in French-speaking countries, especially with, we have a partnership with the UN, and we focus on the SDD number 3 to promote well-being at all ages and to create strategic partnerships, SDD 17. I just want to say two things today. For the strategic partners, we have partners that we consider to be very important. The African Association of Neonatology, and other presenters. These are international partners, and it's also very important to collaborate with local organization to support partnership and local support and local partnerships. Next slide. The KZ Foundation, ever since 2014, we have the NEST model, which is a technology survival essential, neonatal essential survival technology. The goal is reduction of neonatal mortality, 0 to 28 days, premature babies, low weight birth and sick birth, especially in sub-Saharan French-speaking African countries. The reduction to put theory into practice. And you can see according to the cycle to support the partner in the identification of needs, formulation of action plan, implementation and action. This model is implemented in various African countries, and it's been 2 years that the model is being implemented. You have education, space, implementation, and follow-up. So for the pillars 1 and 2, you have the education and solidification, reinforcement of capacities, and work with patients and families. And for spaces, we work on the importance of neonatal work and care to support family centric care and zero separation between mommy and baby, or mother and baby. This will require investment and organizing spaces to reduce neonatal mortality. Next slide, please. Pillar 3 and 4, we work on improvement on quality based on data, and we have also we work on the advocacy and networking, creation of strategic partnership and engagement of local stakeholders as well as international and institutional, whether the Ministry of Health or other actors. And there's a lot of interventions. And as a foundation, we also try to coordinate some of these activities. Next slide, please. As far as equitable access to resource, and you have the NEST model for the equitable access to resources. Why? Currently, English is the global health language, and concentration of financiers and actors in English-speaking countries. And so French-speaking language countries don't have access to donors and to resources. So the Chiesi Foundation wants to reduce this gap and make an equitable access to resources for everybody. We decided to position ourselves on French-speaking African countries. We're in Benin, Burundi, and other countries. And from this time on, we will launch our initiatives and activities in exchange in South-South and North-South. We facilitate the translation of documents and initiatives. And we started the creation of strategic partnerships at different level. So during the first International Congress on Neonatal Health, And so we facilitate, of course, translation of document and of initiatives, and also strategic partnerships at various levels. A few examples of initiatives from the Chiesi Foundation. We have a good relationship with the Nest 360, and for the translation in French of the U toolkit and implementation of the toolkit for sick and lightweight newborn, and we have a series of French seminars in the French language. Next slide, please. We have also an opening of a headquarters in Rwanda of the ANA. And we have an organizational support of partners. We also supported of the launching of the ANA in English, French, and Portuguese, so trilingual, and the publication of the ANA journal in French as well as in English. This picture is taken during the first international Congress, and we met for the first time most of our partners, foundation partners. Recently, at the beginning of the year, we supported the launching of uh, of uh, of the meeting organized in Zambia, the launching of CONP in Zambia with the participation of 3 delegations of French-speaking Africa, Burkina Faso, Ivory Coast, and Rwanda. And we were able to invite in Burkina Sasala and who took some initiatives, and the director, Mrs. Sangoul, working for French-speaking neonatal nurses who created the WhatsApp group. And we facilitated the launching of a group, of that group. Donc, we just launched a partnership with COINN, COINN, and we hope this will be growing with the years. To finish my presentation, this slide is very important. We have a synergy with the WHO, the World Health Organization, and recommendations of the OMS are in progress. The document will be ready in about 2 weeks. It'll be available online. And the recommendations for the kangaroo mother method and the guide is already available in French and will be launched online on the website in about 2 weeks. And there is also the implementation of the kangaroo mother strategy available in about 2 weeks. So these documents will be available, and we're very happy to announce this today. So we have a good relationship with the MOH of Burundi, the Ministry of Health, and we have a support for an acceleration implementation plan from the ENAP during the international convention of Burundi, and we have a foundation, and we are validating it right now with the Ministry of Health. And we will broadcast the information, and the picture at the bottom right is it in the kangaroo mother of a big hospital in North Burundi, a hospital which was organized by the Ministry of Health as a hospital for broadcast and training of kangaroo mother at the national level. These are initiatives of our foundation. I was very happy to be able to share this information with you. I will close here. Thank you very much for your invitation and for your attention. Thanks. Thank you so much, Massimo, for your amazing presentation to show the engagement of the foundation. Uh, uh, to show about the structure of various organizations and initiatives that you explained to us, and the way things work, and all this was very, very interesting. And also the partnership with the WHO for translation of the material. We don't have much time left. Do you have any comments or feedback or questions? And then I'm unable to access the Q&A. Is there an urgent question among participations? You have a few questions for Frank. How can we become registered to the journal, ANA journal, or subscribe to that journal? Thank you for your question. That journal, you don't need to subscribe to it. It's just available. You just go to the website and you can access it at any time. So there you go. You have any other questions? Madame Oliveira had really talked about documenting all of these information in our structure. So I agree with her. This is a strategy that talked about neonatal mortality. This initiative, it was very important. So sorry, I cannot see the questions which have been asked from my own computer. Any other urgent questions? I see comments. Do you have advice for English-speaking organizations for translation for to documents in French? It takes a lot of time and a lot of resources. Oliveira. Yeah, that's a question, important question. I think the toolkit, on the toolkit we create a dictionary with technical terms and medical terms used in French and in English. Perhaps we could add, post a link in the chat. But we need to have more resources. This is linked to the conversation and the advocacy for translation of documents and guidelines by organizations as well. And also journal article consumers would like to have access and abstracts and articles translated in French. In case there is a question for you. They want to know if mothers are clothed. Thank you for the question. Yes, they are clothes. They have T-shirts. Uh, they show uh, how to use it in the hospital. So there is no T-shirt between the mom and the baby, so that the baby can touch the mommy's body. Okay, we need to close now because we're out of time. So we ended this webinar, which was very interesting and which help us know all the tools available in the toolkit. And among others, it's a French version. And I want to thank Lauren and to have organized everything. And thank you, Dr. Frank, um, and thank you, Massimo, for your presentation. And thank you to all the participants to stay over time with us. Thank you, everybody. And I will give the floor back to close the session.